Do you have dizziness, vertigo, lightheadedness? Have you been to your doctor and he's diagnosed you with an inner ear problem, maybe giving you some medication? Do you have a fear of falling because of this? Well, if that sounds like you, please listen to the rest of this video because I have some exciting information to share with you that it could literally change your life. Hi, I'm Dr. Cliff Griffin, and I've treated literally hundreds of people over my 25 years in practice that have had these conditions, these balance disorders of lightheadedness and vertigo. So I want to go over a few of the most common of these disorders we found over the years, number one being vertigo. Okay, a lot of people have heard of that. Well, there's two different types actually. There's spinning vertigo, and there's vertigo without spinning. Then there's something called ataxia. Well, that simply means clumsiness. Then we also have people that have been diagnosed with disequilibrium. Now what that is, those are those people that when they're going down the hall, they actually have to hold on to the walls or hold on to a chair or a doorknob because they have a great fear of falling. Another vertigo problem we see is called visual vertigo. Now, a lot of people have experienced a small sample of this. Have you ever been at a stoplight, sitting in the car, and all of a sudden it feels like you're going backwards and you slam on the brake, only to find out that the car beside you was pulling forward? Everybody's probably experienced that from time to time. Now, just think of having that 24/7, the whole day. Your whole day is you're having these visual disturbances. That's visual vertigo. Then there's something called Meniere's disease. Now, Meniere's disease is actually, it's a disease of your inner ear, where there's damage to the hearing, the cranial nerve that controls your hearing. And so you have a loss of hearing. These people, when this attacks them, they can't stand up. They're usually lying down and their head's spinning. A lot of vertigo. They actually even end up vomiting in most cases. Then on the other extreme, you have just lightheadedness. Now those are the people that they wouldn't really say it's dizzy or vertigo. Something just doesn't feel right, and they know something's wrong. And then we have something that's been more popularized lately, and that's called benign proximal positional vertigo. Big words there, but what that is, they call it BPPV, and what that is a situation where there's debris that actually start to be laid down in the inner ear. And so what that ends up doing is if you bend your head backwards or move it too quickly for 10, 15 seconds, the whole room starts to spin. Okay, and so that's what that type of situation is. So I want to talk for quickly a few minutes just about what the three main players are in all of these balance disorders. If I can show you this little cutaway here. This is actually a model of a cutaway of the inside of your head and neck. So as you can see, we have the brain up here. Here's your spine. And the spinal cord is that white piece right there. That leads up into the lower brain stem. Then this green part right here, that's your cerebellum. That's one of the main things involved with all balance disorders, with dizziness and vertigo. And the cerebellum, the three main things that it does is it controls all of your posture muscles, all of your spinal muscles, and it also has to do with eye termination, so it's very important. The second player in balance disorders is your vestibular apparatus, which that's basically your inner ear, and that's what most people associate dizziness and vertigo and things with, is a problem with the inner ear. Now here's the thing, is your cerebellum is very intimately connected with the vestibular apparatus, the inner ear, through the 8th cranial nerve. So they work very closely together to maintain your balance. The third player in this is your feet. Okay, you have to have the proper proprioception going into your feet to know where your feet are. Okay, so literally what happens is the nerve endings in your feet come up your legs to the spinal cord, to the cerebellum, and they coordinate and allow you to know where your feet are at in space. And of course, it's very common to see people where that's off is they slip a lot, they may stub their toes, twist an ankle, and a lot of them end up falling. Now, if you're a senior citizen, I got to tell you that is the #1 cause of death in the United States is falling. And that happens and that's with senior citizens though, okay? So it's very, very serious. Now, most people with these types of disturbances, they end up going to their doctor, and he may determine that it's an inner ear problem, and he gives you the drug called Mexaline, okay? And that either works or it doesn't. It either helps you or it doesn't, okay? A lot of problems, or most of the largest percentage of the problems that we see in our office is a problem with the cerebellum. It's an overfiring of the cerebellum. It's simply not receiving the proper stimulation and fuel that it needs to balance so that you can avoid these balance disorders, so you don't have the dizziness and vertigo. See, the fuel you need to allow your brain to be stimulated properly, specifically the cerebellum, where does that come from? Well, it comes from food. Okay, that's why you need to eat good food, not junk food. Okay, your brain needs proper vitamins, proper minerals, proper essential fatty acids. And that, along with oxygen, produces glucose. And that actually is the energy. That creates the energy that your body needs to work properly and for your brain to work properly, especially the cerebellum. The other thing that the cerebellum needs to function properly, so that it fires properly, is stimulation. Where does that come from? Well, it comes from movement. Moving your arms, moving your hand. It comes from your spine. Every time you bend and move your spine, that sends information, neurological information, and fires up to that cerebellum. And that's very important in the way this works. So, we told you what causes the vertigo, the dizziness, the balance disorders in many, many cases is a decreased firing of the cerebellum. Okay? What happens? How does that cause that? Well, it's stress. Physical stress, chemical stress, emotional stress. Physical stress, this is a plastic model of the spine, not a former patient. Now, most people, they realize the spine is supposed to be straight. Now, if you turn the spine, though, from the side, it has curves in it. These curves are very important, and you can bend and twist, and it always comes back to that normal, natural C-shaped curve as long as your cerebellum is working properly. Now, I talked about physical stress. What that does is if you had an accident, a fall, some type of trauma where you lose this normal, natural curve, that is going to cause a decreased firing to the cerebellum. Okay, we see that every time. With chemical stresses, well, that has to do more with the food you're eating. The toxins in the environment. There's so many toxins and poisons in the food we eat. That's going to cause a decreased firing of your cerebellum as well. So, when you come into our office, we need to address these areas, and 4 main areas we need to address in particular. Number 1, it's my job to treat you as an individual and not your diagnosis. A lot of people come in, they've been diagnosed with many different things, and see, if the diagnosis that you came in with, if it was correct and they were treating you correctly, you wouldn't be here. So I'm not going to treat your diagnosis and your disease. We're going to treat you as an individual. My second thing, or my second job, is what we're going to do is we're going to do a neurological exam, a proper neurological exam, because we need to know, is it your cerebellum that's the problem? Is it your inter-ear, your vestibular apparatus? Or is it your feet with a lack of proprioception? You got to find out exactly where the problem is to treat you right. And that's number 3, why we take x-rays. We want to see, where's that curve at? Is that involved? So we'll do that. We also want to take a good look at your diet, okay? And possibly your blood work. We want you to bring your blood work in to us. And if you don't have blood work, we may require that depending on what we find. Because we want to see your strengths. We want to see your weaknesses. And if you do have weaknesses, we will treat that neurologically to help your brain work better and fire properly. So, what's next? Well, if you're tired of living this way, if you're tired of having a fear of falling every time you go out, then what I want you to do is I want you to fill out this form here. Okay, and that's going to allow you to come into